Unintentional weight loss is one of the symptoms you've got to be on the lookout for. This is for you or for anyone in your life that you know. What do I mean by unintentional weight loss? I mean when someone starts losing weight and it's not because they're trying. They didn't start a new diet, they're not exercising more, they're not trying to lose weight, but yet they're losing weight anyway. Unintentional weight loss, no matter what the age, okay, young people, old people, I am always concerned, and cancer always needs to be ruled out, okay? If we have a reason for why you're losing weight and that reason makes sense, that's one thing. But you don't know why you're losing weight, that's something that has to be evaluated. Guys, I'm Dr. Jen. We are talking about 9 potential signs of cancer that you should not ignore. The next thing is night sweats, okay? Now, night sweats can happen for a number of reasons, right? You can have hot flashes. Obviously, if you're sick or you have a fever, right? So sometimes fevers break at night or you sweat at night. That's not what we're talking about, though. We're talking about night sweats, drenching sweats at night that happen, and there is no underlying illness that you're aware of. You do not have menopause or not in menopause that you know of, etc. Okay? Night sweats always needs to be evaluated to make sure that something like cancer is not going on. The next thing I would say, number 3, is blood when you go to the bathroom. Blood anywhere when you go to the bathroom. I mean blood either when you urinate or when you have bowel movements. If when you urinate there is blood, that needs to be absolutely brought up to your doctor ASAP, and you need to have a full evaluation, in part to rule out cancer and also to figure out what's going on, okay? The other part of that is if you have blood in your stool, meaning when you have a bowel movement, if you have blood in your stool, you need to be evaluated as well. Now, let me remind you, I'm going to say this a lot because some of you watching this video might now start becoming afraid of everything I'm saying and say, oh my gosh, you have cancer. Remember, everything I say does not have to be cancer, okay? And in many situations is not. But when we as medical people hear these things, we know we have to make sure it isn't cancer, okay? So blood in your stool doesn't mean you have cancer. It can mean just that you have hemorrhoids. But you have to make sure you don't have cancer, and that's why you got to bring it up to your doctor. So blood in your urine, blood in your stool, okay? Swollen lymph nodes that won't go away. I picked up a patient's throat cancer by a lymph node that she had. This was, gosh, this might have been 12, 13 years ago. I'll never forget it because she'd had a cold, middle-aged adult. She had a cold, but then, a few weeks later, she came back to me. She's like, my lymph node never got better. And she had a solid lymph node on the side here that was kind of firm and just, didn't seem right. Your lymph nodes that are there that won't go away or that pop up that seem unusual, they need to be evaluated. Okay. Not every lymph node means it's cancer. No, it could mean just that you're fighting off an infection, but allow your doctor to help you figure that out. Okay. The next thing is unusual vaginal bleeding. This is really important, ladies. If you are in menopause, you should not be bleeding by your vagina, period. If you are in menopause and you have a period or you start to bleed, you need to run, not walk, to your doctor's office, to your GYN's office. That has to be evaluated, and we have to make sure that cancer is not going on. You shouldn't bleed after you go through menopause. And if you do, that's got to be looked at. Or vaginal bleeding that's unusual sort of at any other time or place, right? So in between periods or things like that needs to be evaluated. And I think that makes sense to pretty much everyone. All right. The next thing, let's go to the throat. Actually, let's start with the lungs. Nagging cough that doesn't get better. Cough doesn't go away. Cancer needs to be ruled out, especially in people who are high risk, like smokers, etc. Okay, that needs to be ruled out. Also, moving upwards, hoarseness that lasts for more than 2 weeks has to be evaluated. Okay, you got to evaluate that to rule out cancer. Also, I would say, if you have trouble swallowing, that's a problem potentially too. Okay. And then the last couple of things I'd mention is this: bloating. Very non-specific symptom, okay? It's very but people know when they feel bloated or they just don't feel right in the tummy. Something that kind of goes on for a while, make sure you're getting worked up for that. Because sometimes I've had patients with ovarian cancer in particular, or pancreatic cancer, and sometimes those cancers can be very non-specific, and people just have what we call non-specific symptoms. They just don't feel right. They just feel a little in the stomach, Look, if you've got bloating, something doesn't seem right, make sure you bring it up to your doctor so that we can evaluate you. And I would say the last thing, and by the way, don't turn off the video after I say this last thing, because I got to say one more thing that I think is going to be really important for you. Lumps or bumps, okay? Breast lumps, testicular lumps, skin lumps, bumps. You see or feel an unusual lump or bump, that's got to be evaluated, All right. Now, let me just say this for all of you out there who are watching this video. This video is not to make you sort of do a scan of your body and think about every situation you've ever had in your entire life and panic about it. I know that these videos like this can do this. Remember, everything that I mentioned doesn't have to be cancer, and many times it is not. But I'm giving you this information to know that if it happens, you need to be on the lookout and sort of on high alert to take it to your doctor, okay? Don't freak out and don't start sort of evaluating and looking at everything you're doing. And I don't want you to lose sleep over this, but I just want you to be informed. And also so you can help other people in your life as well. Again, allow your doctor, allow us to help you with this. So let me know if this was helpful. Write it in the comments what you thought. Please share this video with other people. For those of you on Facebook, please like and follow my page on YouTube. Please subscribe to my channel. By the way, I'm Dr. Jen Caudle. It's good to see those of you, especially if you're new, if you're returning. I'm so grateful for you. I'm on TikTok and WhatsApp, etc. at Dr. Jen Caudle. And go to my website, www.drjencaudle.com. You can sign up for my free health newsletter. Guys, I'm Dr. Jen. I'll see you soon.